from the waiting rooms. We're going to start our recording. Seeing some familiar names. Good to see our friends that join us tonight. Thanks for coming. My name is Tara Sanft. I'm the director of the Survivorship program here at Yale. I'm so thrilled to be with you tonight in this second of 4 Cancer Survivorship Month series. We have 3 fantastic panelists tonight who are going to be talking about living with cancer chronically. Before I have them introduce themselves and start the program, I just want to orient you to our survivorship series. These are Smilow shares. They're patient-facing series that we've done since the pandemic in the month of June to celebrate and honor and recognize issues that are specific to survivors of cancer. And that definition includes anyone who's been diagnosed with cancer. And tonight's topic is particularly important because we really haven't addressed this head on in this series. And I feel like this is an important topic that is becoming more in the public eye for good reasons. And we are so fortunate here to have Dr. Maryam Lustberg, who has joined us from the Ohio State over a year ago now, and is really a true expert in this topic area, a supportive care researcher and a breast oncologist and the director of our breast group. So while, again, some patients who are living with cancer chronically have breast cancer, that's not true of every patient. There's many patients who are living with other diseases, but some of the issues are the same, and we'll touch on that tonight. Last week, we had a fantastic session, Restoring Your Body to Integrity After Cancer. If you missed that, these are all going to be posted on our YouTube channel. Next week, we talk about cancer and the family, and we'll have several panelists discussing various issues that relate to how cancer can affect the family, including genetics and clinical trial participation and support services, et cetera. And then on June 28th, to close out the series, we are going to have a fun group of people talk about myths and social media. And just today, we got this long list of social media websites that are claiming lots of different things, and our dietitians and physical therapists and medical professionals will be, saying true or false to some of these websites and these myths around cancer. So again, I'm Tara Sanft. I'm the director of the clinic. We're so excited to have you here. We have 3 panelists tonight. The first is Dr. Maryam Lustberg, and she will be sort of kicking us off. The second will be Chloe Shevlin. I'll just say your names before we get started. And then our third discussant will be Angela Khairallah. And you can each introduce yourself when it's time. Thank you, Maryam.
Sure. Thank you so much for joining. Tara, you can see my full slide?
Yes.
Okay, great. Thank you to all the attendees and my co-panelists. And I'll be talking broadly about survivorship care and the most inclusive, true definition of what survivorship was intended to be. And just to get us all on the same page, a cancer survivor, based on the National Cancer Institute definition, is really any individual diagnosed with cancer from the time of their diagnosis throughout the balance of their life. And, I think this has been the most inclusive definition, talking broadly, nationally and internationally. Has this always happened that way? And the truth is, I think many of you can attest to this, that perhaps for many reasons, we have not been always the most inclusive in terms of how we have provided various survivorship programs. The tides are changing. But for many a time, I think, a lot of survivorship initiatives were geared toward patients with earlier stage disease. Some of you are familiar with the idea of ringing the bell in a radiation suite, signaling the end of treatment. And many patients have actually written about this, that if they're on ongoing treatment, if their treatments never are ending, just how it feels to see this bell ringing or hear this bell ringing and not being a part of this ritual. Of course, we're happy for patients who have that happy ending, but just a recognition that the cancer continuum means different things and has different components for each patient and family. And then the term survivor in many ways doesn't resonate with some of you. You may not like the term. You may just feel like, well, does it really describe me? And we have heard this over and over again from different patients and families that maybe this is not how they want to think of themselves, and that's okay, because you get to define what you label yourself and what you call yourself. So many patient advocates have spoken about how maybe there are other ways that they would like to describe themselves, and we are absolutely accepting of this for sure. In the last few years, the National Cancer Institute has really paid increasing attention to make sure that we are paying the attention to patients and families who are living with advanced cancer. And this may be patients with metastatic cancer. It also applies to patients with hematologic malignancies who may be on ongoing therapy. So they're not necessarily described as having metastatic disease, but they are on chronic therapy for a hematologic diagnosis. And this pool of patients living with advanced disease, and we can call it living with chronic disease, there are different ways to refer to this, may get to this point from different junctures. They may be initially diagnosed with a more advanced presentation of the disease, or they may be initially diagnosed with early stage cancer, and at some point, even after curative intent therapy, have a more advanced presentation. So really the idea is that no matter how you end up in this pool, your needs are important, and we want to be absolutely paying attention to making sure that all your survivorship needs are being addressed. I saw this online, and it's not meant to make light of any of the needs, but I think it really highlights some of the issues that I've also heard from my patients in terms of living chronically with any type of cancer, which is that you're going to get well-meaning comments from different folks that may or may not resonate. You may look really well, and people say, well, you don't look sick, or I get tired too, or what's wrong with you? And so these are some of the ongoing challenges that a lot of patients relate to me when they have ongoing treatment. And it can wear on you, and this is in the question and answer. We want to hear more about how we can better support you in all the various ways that dealing with ongoing cancer treatment can impact you. It can obviously impact you physically. If you're on ongoing treatment, that may mean that you may have ongoing tests that may spark some anxiety. Waiting for scan results can be very stressful. The treatments themselves can have a number of different side effects, and it's not that you can say, well, I'm going to do this for 3 months and be done. It's a series of ongoing treatments, and the toxicities can sometimes add up. All of this can lead to an emotional strain that, again, we as a program, as a cancer program, as a survivorship program, we want to be absolutely sensitive to the emotional toll that this can make. This can present. So there's a number of different resources that are available, and we want to make you aware of it. being on ongoing treatment can have impacts, positive or sometimes stressful effects on relationships and sexual effects from ongoing cancer treatment. Lots and lots of resources are available for this in our cancer center and also in other circles. So again, I want to really normalize this and really carry the message that we want to be able to talk about this, and that as cancer professionals and as a cancer team, we really want to work with you and with other specialists that are involved in your care, which brings me to coordination of care, which is that typically patients living chronically with cancer will have a number of healthcare professionals who are involved in their care, and that may include a primary care provider, it may include additional specialists, and really, our goal is that all of us are communicating very closely with each other as well as with you to make sure that a cohesive plan of care is communicated to all so that we're all on the same page. Living with ongoing cancer may also have financial implications. And again, we want you to know that you can speak openly to us about this and that there are a lot of resources available. I wanted to highlight a national program that was created to provide additional resources for patients. It was created by a patient living with metastatic breast cancer, and it's called Project Life. And the website is listed here, and it has a ton of free programs geared toward various aspects of survivorship needs for those living with advanced cancer. And this is one of many, many programs, and I just wanted to highlight this. And as you interface with social workers within the program, as well as with the survivorship specialists with the program, we can also direct you to these web-based resources in addition to all the programs that we provide here. As we mentioned before, the tides are changing, and the National Cancer Institute, which is funded by your tax dollars, is really paying attention that we need to really better address the needs of individuals living with advanced cancer. And there was a specific request in the last year to receive research proposals to better understand these unique needs. And so the best researchers around the country are really putting their best thoughts together to come up with well-designed research studies so we can better understand all the different ways that we can better address your needs. So I think there's going to be a lot of wonderful evidence-based initiatives that will come out of this body of research. So I do have a lot of hope that we will be able to offer even more and more for patients living with cancer in the coming years. I will close with a quote from a patient. We ran a special series in the Journal of Cancer Survivorship, specifically focused on the needs of patients living with incurable cancers. And this particular quote was highlighted as the opening to the series. So I'll read parts of it. I think it's important to close my section with words of a patient. So while cancer survivorship is defined as starting upon diagnosis, inclusion of patients like me in research program offerings, discussions has not yet matched that definition. We're not automatically included in any of it. But the fact is that even those survivors who are not beating the survival odds deserve to have their needs seen and addressed. It's time to leave behind the arguments I've heard as someone living with metastatic cancer, and that we have have many problems that make including them too difficult. That people with incurable breast cancer deserve to have their needs met and addressed. So thank you. And I think my colleagues will have additional components that I know you will find helpful. So with that, I'll turn it over to Chloe. Thank you so much.
Thanks, Dr. Lustberg. Hi, everyone. I am so grateful to be here tonight. My name is Shevlin, and I am one of the quality and safety coordinators for our Smilow Cancer Hospital. And I'm very passionate about the topic I'm going to share with everyone tonight. It's probably not everyone's favorite topic. I can guess that, but I'm hoping that what I can share with you tonight kind of maybe gives you a little bit different of a perspective to take on it, and something that you can take away with you. So I'm going to share my screen. All right. And can I just have can you guys see this slide?
Yes, we can.
Okay, great. Thank you. Great. So tonight I'm going to be talking about advanced care planning. And this is something that I've been doing a lot of work with a lot of our nurses, our palliative care team, our chaplain team, our social work team, our oncologists, really talking a little bit more about advanced care planning and how can we better support our patients with advanced care planning, regardless of where they are at with their treatment, with their disease, and honestly within life. How can we help support our patients? And so that's what I'm hoping to talk about today. And this is something that is definitely a very stigmatized topic. And what we're trying to figure out is what we can help do in order to kind of change the culture and kind of normalize the conversation related to advanced care planning. So what I'm hoping to share today is when I'm saying advanced care planning, what am I meaning by that? I'll just kind of briefly share what I mean by advanced care planning. You'll probably see ACP pop up on some slides, and when that's there, it's referring to advanced care planning. I want to share who could engage in advanced care planning and why we should participate in the advanced care planning. And then I have a summary at the end. So I wanted to start with a quote, and this is a quote from Jacqueline, who's one of our amazing advanced practice providers. And she shared this at the beginning of a work group that I was involved in. And she said, I truly believe that advanced care planning is about how you want to live, not about how you want to die. And I just thought that was so powerful because I think a lot of times we associate any sort of advanced care planning with, at the end of life. And actually, it's really important, which I'll get into in a slide or two, that this is something that all of us, regardless of where we're at within the continuum of cancer or just with the continuum of life, can support ourselves and our loved ones with. So when I'm saying advanced care planning, I'm really talking about two pieces. I'm talking about just having some discussions, discussing, your values, your wishes with your loved ones, whomever you care about. And that's, the huge piece of starting advanced care planning is just having some conversations. It's something that might take time to figure out. What are your values and what do you want your care to look like? But it's something that is important for all of us to kind of consider and have those conversations. The second step is really important so that we can honor those preferences. And so the documentation piece is so important so that, again, if we ever get in a situation where we need to honor those preferences, we have the documents, we have the tools that we can do so. So when I'm talking about these documents, there's two main ones that I'm talking about. The first one, you might have heard it as appointing a healthcare proxy, a healthcare representative. There's a lot of different terms. But essentially, the first document relates to if you are unable to speak for yourself, who you would like to speak for you. And so this is different than your emergency contact that's documented on file, we actually have a legal form that, we can help you complete and make sure that's in your file, and that way it can be accessed if ever needed. The second piece that we talk about is a living will. And a living will just dives a little bit deeper into capturing your treatment preferences. So we have two really great versions here at Yale. We have one that is in plainer language. So for someone who's not a clinician like myself, that's the one that I gravitated towards to just kind of better understand, what was being asked. And then we have another that has your more traditional, like technical terminology. Both are great options. Also, if there's another option, we accept any living will. It doesn't have to be a Yale living will, but we look for that legal documentation that we are able to make sure that we have on file. And I just wanted to show a picture of what those might look like, at least the top of them. And so the top one is the treatment preferences and living will. And the bottom one is the one that I mentioned where it's just written a little bit differently. And so it's written in a way that, again, we're hoping everyone can understand. There's many different levels of understanding of some of these technical terms. And this is something that this second option really breaks down. So that's the legal documentation piece of it. But really, who should be participating in advanced care planning? It's you, it's me, it's everyone on this call. Everyone over 18 can really be starting these discussions and thinking about those treatment preferences. It does not mean that you need to feel like I only can think about this, I only could talk about this, when I'm nearing end of life. It's something that we want to make sure that we have on file in the worst case scenario to support and honor your wishes. And that's what we're talking about with this early advanced care planning. There's actually some really great initiatives happening with a lot of our primary care programs right now, and helping with earlier advanced directive completion. And so it's something that as a whole, we're trying to normalize in our conversation. So again, why would you try to start these discussions? Why would you think about engaging in advanced care planning? Well, it's just to be prepared. We never know what life is going to throw our way. We just don't. So it's not something that we're doing to assume the worst is going to happen, but it's something that we're doing so that we can honor your preferences and support your loved ones. So taking that guessing game out of the equation, and just helping everyone have, as much as possible, an assurance that your preferences are being met. And so this is just why it's so important. So this might be very overwhelming, and that's okay, because advanced care planning does not need to happen in one, sit down conversation at the dinner table. It is something that, takes many conversations, maybe with several different loved ones. Some research. We have a lot of amazing resources on some of our websites that can share some documents to help walk through this thought process of how do I even identify my values and my, what my wishes may be. But the really important thing is just to start thinking about it. It's not that these documents need to be on file tomorrow, but this is something that, we can start thinking about, start having these discussions. And again, there's some great resources that we have available to be able to kind of start that thought process. So again, in summary, like I said, anyone, we're hoping to help support you with advanced care planning. This is really 3 pieces: discussing, making sure that we're documenting, and then making sure that we're sharing and we have on file. And this is important so that we can be prepared to honor your wishes and support your loved ones. And all it takes to start is just to start having some conversations. The last thing I wanted to point out is that if this is, overwhelming, if you want to learn more, then I know we have time for Q&As here, but also we have a really neat opportunity where virtually you can join an advanced care planning education session. And these are led by some very passionate clinicians who really just want to talk to patients and have a dialogue about advanced care planning and how they can feel supported in some of these conversations, in this documentation. And so these are live, but they are virtual, so they can be joined from anywhere. And it's something that is focused on the participants present and making sure we answer all questions or concerns that they have. So that's a great opportunity. And we do have one coming up next week. So the timing, worked out really well. If you are interested in learning more about that, I could put my email in the chat and would be more than happy to help you get registered for one of those sessions. But again, thank you so much for the time to share this important topic today. And yeah, I really appreciate it. And I think I'm going to pass it off to Angela.
Hi, good evening, everyone. Hopefully, fingers crossed, I'm having some internet connections with the weather, but hopefully it will hold out for at least the next 8 to 10 minutes while I'm talking to you. Earlier, I believe I was introduced, but I'll introduce myself again. My name is Angela Khairallah. I happen to be one of the social workers in the Yale Cancer Center Survivorship Clinic, as well as the Smilow Breast Center. And it's such a privilege to be here tonight with all of you. So thank you so much for joining us. And with that, I'm going to be talking to you tonight about scanxiety and fear of cancer recurrence and progression. So I'm going to go ahead and share my slides. Okay, hold on, that didn't work. Give me a second.
And
Okay.
Angela, you're joining a new team. This might be an okay opportunity to sort of put a plug in for that, if I could say that.
So thank you, Tara. So soon, eventually, I'm going to be transitioning to our psycho-oncology team. And so I'll be leaving behind my tenure at, actually 10 years as of yesterday, that I've been working in the survivorship clinic as well as the breast center. So I'm very excited about this new and upcoming opportunity. And so stay tuned for that. But I'll be facilitating groups as well as doing some individual work. So thank you. All right. And with that, let's go ahead and get started. Okay, can everybody see my slides okay?
Yes.
Excellent. Okay. So in the past, when it gets shaky, I sometimes have to turn off my video, so just bear with me. Okay, here we go. All right, so scanxiety. So it's exactly what we think it is. It's scans plus anxiety equals scanxiety. And so this truly is a term that is often used amongst many, many cancer survivors. And so, well, what is it? Well, it's exactly what we think it might be. It's the worry, the stress, the fear that we experience prior to, during, and after scans. And these emotions can be quite difficult for many cancer survivors to navigate. And many of you can experience different levels of anxiety that can impact all aspects and quality of your life, including your daily activity. And it truly does affect your mind, your body, your feelings, your physical well-being. All aspects can really be impacted. And I really want to emphasize this. It's common and normal. Let's say that again. It's common and normal to experience some level of scanxiety. I can't tell you how many patients I talk to on a daily basis who experience some level of this. And it truly is different for every individual, differing amounts, and you can experience it at different times, again, before, during, or even after while you're awaiting those results. And it can really range from mild worry to even strong panic and distress. This is quite common for many of you because you've already lived through it. You've already lived through receiving, negative results from earlier scans that you've experienced. And you might have these past memories that really get amplified and make you feel somewhat insecure and even anxious and somewhat helpless as you're awaiting those results. And stress and anxiety can begin from the moment you're told by your oncologist, oh, we need to have a scan and let's go ahead and schedule it for you. It can start even at that point for you. And it's also important to recognize that even minor stress symptoms can quickly lead to fear of cancer recurrence and progression, which we'll talk about in just a minute. So what are some of the common signs? Yeah, how do you know that you're having anxiety? Well, you might experience some trouble sleeping. You might not feel hungry, or maybe you're stress eating. I know a lot of patients talk about that. Your heart rate might be being faster than normal. Your blood pressure might be up. It's not uncommon for patients to even come to the doctor and have their blood pressure go up a little bit. Headaches, muscle aches, sweaty palms, nausea, mood swings, irritability, sad or having worrying thoughts that you just cannot shut off, that are intrusive, trouble focusing. You might feel like you're out of control. You're not showing any interest in hobbies that you once enjoyed, and also having that fear that your cancer could progress or even recur. So let's talk about what it might, be like, to do a scan. So you find out that you need to have a scan. So maybe you start to worry the second you're told it needs to be scheduled. You feel stressed days before the scan. And even on the day of the scan, as you're getting ready to go to the hospital or the clinic, you're starting to get nervous. And on your way there, and while you're sitting in the waiting room, you're nervous as you're sitting there. So how might you manage this? Well, sometimes it's helpful to schedule it in the morning. That way you don't have several hours throughout the day where you're thinking about it. You get it over first thing in the morning. Write down questions for your medical providers. Ask them how you might get ready for the scan. What's going to happen during the scan? How long will it take? How long will it take to get the results? That way, sometimes having that information helps you feel more prepared. And then talk to your oncology team about the concerns that you're having. And, how long will it take for me to get those results back? Sometimes it's helpful to be in touch with family and friends to turn to for support during this time. Going to a support group, reaching out for that mental and emotional support, always learning and practicing, relaxation exercise can be quite helpful for many patients. And so again, just, and then just becoming educated about what anxiety is. So when you are experiencing it, you go, oh, okay, this is that anxiety stuff that they were talking about, so that you know that, again, that it's a normal and common thing to be experiencing. So on the day of the scan, it might be helpful to do relaxation exercises. Calm yourself down, bring a family member or friend to be with you while you're there getting the scan. Some of you might feel really anxious and uncomfortable, or even trapped where you're inside of the scanner. And you might even feel scared with all the banging and the clanging noises that happen. Ask the radiology technician if it's okay to do some deep breathing activities. So sometimes even when you're in that machine, if it's okay, doing some, guided imagery or some visualization, relaxation, mindfulness meditation can really help calm you down. But also let them know if you're not feeling comfortable in any kind of a position that you might be in. So after the scans, again, it's really normal to feel anxious and worried as you're awaiting those results. And you might experience worrying thoughts over and over and over again. And it can be quite stressful as you're waiting. So how do you manage that? Well, schedule a time with your doctor of when you're going to be returning to review your results. And if it feels like it's taking particularly long to get your results back, don't hesitate to reach out to them. Reach out to them through your electronic medical record, put a phone call in, find out maybe, what might be taking so long. Have a family member or friend go with you when you're returning to review those results. And of course, from the time that the scan ends until the time that you're returning to hear those results, sometimes it's really hard to not think about that. So try to keep yourself busy, reading books, watching movies. Exercising is always very good. Taking a walk, being outside in nature, spending time with family and friends, and of course, trying to practice some relaxation exercises can be helpful. So just overall, kind of in summary, ways to cope, again, with anxiety. I can't emphasize this enough, talking to family members and friends, letting your healthcare team know that you're having anxiety, getting emotional support to your social workers in the clinics. Quite often, whatever care center or clinic you're going to, there's going to be social workers connected to your care team. So asking to meet with them, speak with a psychologist, talk to a chaplain, join a support group. And again, I've said this multiple times, but learning meditation, relaxation, deep breathing, guided imagery, learning about anxiety, that can be helpful. And again, doing things to help distract you, reading a book, watching a movie, listening to a podcast, exercising, and being in nature. So next, we're just going to talk a few minutes about fear of cancer recurrence and progression, and what this might also look like as well. So with fear of recurrence or progression, it really truly is the worry and the fear or the concern relating to the possibility that your cancer will come back or even progress. And it's one of the most common unmet needs reported by patients diagnosed with both localized as well as metastatic disease. And it has also been reported to be one of the most unmet psychological problems experienced among cancer survivors. And I'm sure many of you who are listening today can relate to that. It's associated with impaired quality of life, psychological adjustment, elevated emotional distress, a range of physical symptoms. And things that can contribute to fear of cancer recurrence are screening for your diagnosis, your cancer staging, monitoring for your cancer recurrence and progression, and also those treatment anniversaries or seeing family members or friends or loved ones developing or experiencing cancer or progression. And it's estimated somewhere between 50 to 70% of you across all different types of cancer subtypes might experience some level of fear of cancer recurrence. And just like anxiety, again, I cannot emphasize enough, it's common and normal to experience some level of fear of cancer recurrence. In fact, I would say just about every patient that I speak with has some level of this. And so with the lower levels, it may be some type of adaptive, coping that you'll experience, and it can even encourage positive health behaviors to have some low levels of it. And again, it's anywhere between 22 to 87% report moderate to high levels, with an average being around 50%. And fear of cancer recurrence is not strongly linked to prognosis, and it may even occur in individuals who have a relatively good prognosis. And I can actually speak to that with my experience in working in the breast center. Patients that I've spoken to who have, very treatable, curable cancers that are really early stages can actually have quite high levels of fear of cancer progression or recurrence. So who's the most vulnerable for, developing this? Well, through the research that we've reviewed and looked at, it really tends to, again, it can affect anyone. But for some reason, patients who are younger cancer survivors, and in the literature, when we refer to younger, it really means under 39. Patients who have a higher subjective risk perception have maybe experienced more severe side effects. Maybe you have a past history of mental health issues, including anxiety or depression, a past history of trauma, or you've got relatives around you who might have developed or have even died from cancer. So with fear of cancer recurrence, it really kind of fluctuates between functional and dysfunctional anxiety, and it can affect all aspects of your life. And again, it can affect your emotional well-being, it can cause psychological distress, it can cause sleep disturbances, affect your concentration, and even in those extreme cases, anxiety can develop, anxiety disorders, depression, and even some post-traumatic stress symptoms can be impacted as well. So when we talk about fear of cancer recurrence, it really is kind of, like I explained, it's on this continuum, and it kind of can go from mild, moderate, severe, and then really highly severe. Okay, so when we're talking about someone who might have mild fear of cancer recurrence, you might experience occasional thoughts that come about because of an external trigger, meaning you've got a follow-up appointment, you've got a scan that's coming up, maybe it's your cancer anniversary, meaning the date's coming up that marks when you were diagnosed or when you completed treatment or when you had surgery, and or hearing of a loved one or a family member having a diagnosis, and it kind of generates in these like peaks of anxiety that persist for just a few days, but they really kind of resolve on their own, and they improve over time, and you really don't need any sort of intervention at all. So that would be like a mild form. When we're talking about the moderate levels of fear of cancer recurrence, you might experience more frequent thoughts about your cancer, perhaps more than once a week, where you don't really have a trigger, where you're like, oh, I don't know where this came from. Just all of a sudden, out of the blue, like I started worrying about my cancer coming back, and I don't know why. It just started happening, and I couldn't stop thinking about it. And you might have this perceived ability to control your thoughts and a strong sense of distress that's associated because of it. And it's because you don't know where it's coming from. There's no explanation for it. It's estimated that more than half the survivors and patients with active disease report moderate levels. So when we look at severe to highly disabling, okay? So that's approximately 7% for the highly disabling. This is where you might be experiencing these constant intrusive thoughts that you cannot get rid of. You've got this preoccupation that your cancer will return regardless of your prognosis. You might over-monitor for signs of cancer activity. It impairs your functioning. You overuse the health system for reassurance, or you might do the opposite, where you're so fearful and worried that you avoid coming in for any follow-up care or appointments. You might actually start engaging in some unhelpful coping strategies. You might be paralyzed and not be able to plan for the future. And so planning for that becomes quite disrupted because of the worry and the fear that the cancer could come back or progress. You might constantly search online about cancer and information related to your treatment and your prognosis, where it's like actually impacting your quality of life. You're spending so much time researching this information. And it's unlikely that this will go away unless you get some type of clinical intervention, meaning probably most likely mental health services, meeting with a social worker, a psychologist, that sort of thing. So there was a study done in 2019 of over 1,000 long-term cancer survivors by goats. And they found that across all cancer types, even up to 5 years after diagnosis, they found high levels of fear of cancer recurrence in up to 17% of survivors. And they also found that there were higher levels in patients who had received hormone therapy. And even though fear of cancer recurrence slightly decreases over time, it's still common for mental health problems to be experienced by survivors for even 10 years out from their diagnosis. And it's important to note that this can last for many years, lead for quality of life limitations, and also, again, result in the development of a mental health issue like anxiety or depression. So what are some helpful coping strategies? Well, similar to what we talked about related to scanxiety. Some of the ways that you can, get help if you're experiencing fear of cancer recurrence is making an appointment at your cancer center survivorship clinic. We would love to see you. Ask to speak with a clinical social worker or a psycho-oncologist, or ask for a referral to a mental health provider in your community, a psychologist, a social worker, a psychiatrist. Attend a local support group. Also utilizing strategies like reframing or focusing what is and what isn't in your control. We do know that one of the best things you can do for your mental health is to exercise regularly and try to do things that help you feel better about yourself, like eating healthy and staying hydrated. And sleep hygiene is also very important. Focusing on what brings meaning and purpose to your life has also found to be quite helpful for cancer survivors. Learning to meditate. There's a wonderful walking exercise that I love to encourage patients to do. It's called the 5 Sensing Mindfulness Walk. And so when you're walking outside in nature, just thinking about your 5 senses. What are 5 things that I can see, 4 things that I can hear, 3 things that I can smell, 2 things that I can feel, and 1 thing that I can taste. And so just kind of taking your 5 senses and counting down, and it really helps you be fully present in the here and now, which is what is at the core of being mindful. Deep breathing, guided imagery is really helpful for stress management. And then, of course, listening to music, playing an instrument, being artistic, learning a new hobby, writing in a journal. There's so many things that you can do that can really, truly help you. And with that, thank you so much. And guess what? It worked. I didn't get disconnected. Anyway, thank you so much for being here tonight. And I think the next is if we have questions.
Thank you, Angela, Chloe, and Maryam. This is fantastic. If you want to stop sharing, then we can see you. I have a few things to just bring up or ponder. Maybe I'll just start with Angela one more time, because I started with featuring your new role in psycho-oncology, but you're extremely qualified to take that role because of how many different types of therapy you can deploy to cancer survivors of all different diagnoses. So would you mind just speaking a little bit to particularly the meaning-centered therapy that you have done and how this might apply to patients who are living with cancer chronically?
Absolutely. So there is a form of psychotherapy called meaning-centered psychotherapy. It was actually developed by Dr. William Breitbart, who is a psychiatrist with Memorial Sloan Kettering. And it's really based on the works of Viktor Frankl. who has written many books, one of which is many of you may know is called Man's Search for Meaning. And so really the purpose of this, it was a form of psychotherapy that was developed to have patients learn how to find purpose and meaning when they're being faced with something like a cancer diagnosis, particularly towards the end of life. But actually, if you think about it, thinking about what brings purpose and meaning to your life is something that we can all benefit from. We don't need to be faced with end of life to be able to be thinking and focusing on that. But there is a lot of research to support that this can be a very, very helpful strategy. Thinking about something that is meaningful and purposeful to me might be very different for you, Dr. Sanft, or very different for Dr. Lustberg, and it's really about focusing on something that's very small and mundane, like maybe the tree in your backyard or your cup of coffee that you have every morning, or thinking about wonderful memories that you have, like a wedding that you went to, maybe the birth of your children, a fabulous vacation that you've gone on. And so it's really thinking about those things and focusing on that as you move forward with your life and as you go through treatment.
I know our
Thanks.
patients have really appreciated that. Chloe, advanced care planning is something that we are trying to get every single patient at our Yale New Haven Health System to complete. Is that true?
Yes, it absolutely is true. And it's something that, we've started these group education sessions, but it's something that some of our NEMG primary care practices have a lot of really great initiatives, where patients who are coming in, depending on the location, they just have a lot of support, to kind of offer patients and again, share that this is for everyone. It's not just for someone who has, any sort of chronic illness. It's not for specifically cancer patients. It's just very important, again, to have this information on file so that, again, if we ever get to that point, we can make sure that your preferences are honored, and that your loved ones are also supported in that process. So it's for everyone. It's a huge initiative right now. Not just even here at Yale New Haven Health System, but across the nation. I've been reading so many articles about what people have been trying to do to try and normalize the conversations. And I think it's a really great, initiative to kind of be on this journey and trying to normalize those conversations and try and defeat the stigma, because it just helps us deliver more patient-centered care all around.
Yeah. Are there these forms on the MyChart system where patients could click and fill them in? I think I may have missed if you mentioned that.
Yeah, and that's a great question. So the forms are available within MyChart. You can't electronically fill them in on MyChart. They have to either be printed and filled out, or we have copies at all of our clinics. And we also have on our website, the Spanish version, the English version. We have more languages available if someone is, looking for a particular language, but it's something that, please ask if you want to have a copy that's, other than MyChart, or if you don't have a printer available, it's something that we can help provide you with, a paper copy to kind of look through and consider and talk through.
You could mail it to their homes or something like that.
Yeah. And even there's an option in MyChart to upload them, or to not upload them, sorry, but to send them to your care team and we can get them uploaded to your chart. So, we're trying to kind of improve the ways to have the communication and be able to share these documents and receive these documents and then help make sure they get to the right place. Please ask your care team any questions. And MyChart is a great resource for questions, for accessing those documents, or for sending in documents that you can actually attach in a MyChart message, and we can make sure that those get uploaded appropriately.
Maryam, I have some thoughts on this. There was a comment in the Q&A about, I think they were talking specifically about our series sort of being breast heavy, but I do think that it's worth addressing sort of head on the predominance of breast or maybe even metastatic breast in the world of metavivorship going first or being a loud voice. And, I remember when I started here, immunotherapy was in clinical trials at Yale, one of the first places to host those clinical trials. So it wasn't that long ago that, where we started to make real progress, I think, on some other disease types. But certainly I want to acknowledge that, like, people who are on this webinar that are not living with breast cancer or breast cancer survivorship, tell me, like, what your response is when you get comments from patients about, gosh, it seems like it's all breast all the time. And I know this person was being very specific, but I do think it kind of brings up a bigger issue.
I say that I hear you, and I think it's fair. I think it's when we actually look at the body of published studies in survivorship, I think yes, I think many of them have been in breast cancer, and but I think we are beginning to recognize, obviously, that all survivors have various needs, and I think different cancers, there's a lot more similarities than differences, is my take on just kind of being a more global survivorship researcher, but certainly I think there's unique challenges and different barriers faced by different types of cancer. So I think we need to do better. I think that's what I would say. And I think even the very vocal metastatic breast or breast advocate groups are recognizing that, and as they get invited to various circles to speak about survivorship, they're really making a point to invite and cultivate additional advocates in other areas. So I think if you're feeling that maybe your cancer or cancer type is not being represented, and if this is something you're interested in, I think there's absolutely a lot of opportunities out there to get your voice heard. And I think one way that NCI is actually approaching this is that in many ways, new research studies they're actually welcoming additional studies in other cancer types. So this is something that the survivorship community is taking seriously. And I do want to again emphasize that there are more similarities than differences, and that we can all learn from each other. I think there are definitely common threads within the field of survivorship.
Yeah, I think traditionally across the nation, the survivorship clinics have often either started in a breast clinic because of the long-term survivorship that breast survivors have often enjoyed. But it is like, help is coming. I just met at ASCO this past year with a junior faculty who's at Hopkins, who's a lung cancer, a thoracic oncologist who's interested in and is tasked with starting her survivorship clinic. And, so it's as we get better handles on diseases and we enjoy more long-term survivors, I think the specialists will come. It's just sometimes it's a bit of a catch up, in generations to grow up those investigators and those practitioners. We're getting a few questions in the chat. I can take, there was this first one here. Did somebody answer it? Yeah, so in terms of medical assistance in dying, a person put in the chat if there was counseling regarding this. And, this is a very important topic. Being a reviewer for ASCO abstracts, there's a ton of research going on in this field right now for the past 3 years at least. And the palliative care team would definitely be the place to go and start and to get some questions answered and perhaps even some connections made. It's not legal in Connecticut, but it is legal in some surrounding states. And so I think understanding your options is extremely important so that, decisions that you're thinking about can be made in an informed and supported way. So thank you, Chloe, for putting that in as an answer. Let's see here. I think this is, an important point from Someone writing, right after my diagnosis, before my first treatment, even many people told me, don't let cancer define you. I know they are trying to be helpful, but what is a healthy approach to consider cancer as part of your world when you have been treated and get checked periodically? Reflections on that? I'm thinking of your bingo slide, Maryam, and how many times we've heard our patients say these same things, you know?
Right. No, I mean, I think the attendee has really described it well, that people often come to patients with well-meaning advice, and I think each person gets to define for themselves how they want cancer, what role they want cancer or cancer treatments to play in their lives. And different people have different needs. You know, some may want to completely try to forget about it between appointments, others kind of want to embrace it. So I think my takeaway from that is that every way is right, if it's right for you, and it's fine to explore different ways that might resonate better, and different parts of that cancer continuum may need different coping strategies, and that's okay too.
Big spectrum of how people handle this. And I've even had patients who haven't told their families because they didn't want to deal with any being treated differently than they were treated before. And not everyone has that luxury of being able to decide that. But yeah, these are real things that we hear all the time, and I just appreciate you taking the time to write that. I wanted to ask Angela, in terms of this anxiety stuff, there is now new law where patients have immediate access to all of their medical records. What is your take on this, and how has this either maybe made it worse? Or actually on a podcast last week, I heard a patient say, I like seeing that for myself. I didn't like having the doctor between me and my results. So that was a new take on it that I hadn't heard before, but I'm just curious on your reflections on that.
Yeah, so I've heard the gamut. I've heard exactly like you. I've heard patients say, I really like having this. I really, like knowing that information right away. And then I've had patients tell me, I wish I didn't have access to this. It makes me super anxious. I don't know what it means, particularly if they're awaiting that initial diagnosis and then they get the result, and then they're, going on the website and they're Googling all the medical terms, trying to figure out what it means. And so I think, it's hard to say if it's made it worse or better. I don't know. I mean, I have had a number of patients tell me that it's made them more anxious. And so, we'll usually talk about, well, how are some ways that you can handle and manage this, knowing that result's going to come in. Are you able to kind of wait, to talk to your doctor before you review and read that results? And if you review and read that result, what is the plan? What are you going to do with that information afterwards? Are you going to be able to wait till you hear from the doctor? What if it takes them a little bit of time to get back to you? Then what? And so, talking to them about how to cope with regardless of whatever direction they want to go in, how are you going to cope with that information? And, I'm a firm believer, do what's going to help you feel the most supported, and kind of just on, piggybacking on what we were just talking about with not allowing cancer to define you, and how that does not resonate with some. And so, again, patients have often asked me, who should I tell? Do I need to tell, people in my family? Do I need to tell my colleagues at work? Who do I need to share this information with? And my answer always to them is, tell who you need to turn to for support, and so however you want to define that, turn to the people in your life who you're going to need to turn to help support and guide you through this process. So anyway, thanks.
Yeah, it's always a Friday at 5. I feel like these results are released out into the world, probably about the worst time of the week to get some news that you were hoping not to have. There's 2 comments that I really appreciate reading in the Q&A, and I might sort of read each one and then invite responses. If as needed. I think they're sort of similar themes about coping. And then there's a beautiful comment also in the chat to us that also deserves to be read. So thank you for typing these. One attendee says, my progression anxiety has more to do with future planning and scheduling new classes, teaching courses, and having to leave mid-semester, or complications if traveling between scans. And the second in that theme, I think, I have been a patient since 1997 when I was diagnosed with stage 4 lymphoma. I do not consider myself as metastatic at this time. I recurred in 2004 and in 2017. However, basically I am well. I see a therapist and take meds for anxiety and depression. My biggest fears relate to long-term side effects like chronic and progressing psychological and cognitive changes. I think because I always knew that I would recur at unpredictable timeframes or spans, I worry that I'm considered over-vigilant by my oncology team. I worry about the newer therapies and how that may exacerbate psychological and neurological long-term effects. Thank you so much for typing this. Overvigilance. I have so many patients say, you tell me it's not likely, but I've already been in the not likely. You tell me it's a low risk and I've already proven to you that that doesn't apply to me. You know, I feel like our patients know themselves the best. And so being vigilant is a gift to your team, because you know when things are not right. It makes us uncomfortable sometimes if we can't always pinpoint something that's wrong right away, or if we feel like we're checking often. But again, I think for many patients, the sort of the area, the 95% chance that nothing's going to be right doesn't mean anything to them because they've already been in that 5% chance of where it shouldn't have happened and it did. I don't know if there's other people who have comments on that in our panel. I see some head nods.
It impacts the whole family. I think we've kind of touched on that as well. So I think as we see the impact on partners and children, I think it's important to recognize that as we kind of support the patient living with cancer, or to also recognize the needs of other close members who may have their own needs.
Yeah, and that they're also living their lives fully, as we've seen in these comments. And the chronic and late effects are a real threat, maybe sometimes more than the cancer. We're fortunate here, if you don't know about this, we do have a cancer and cognition clinic that's run by a neuropsychologist who does a lot of testing and can help guide if cognitive decline is detectable. If it's felt and not detected on different tests, there might be interventions that could help make people feel more cognitively healthy. Please reach out to us if you'd like to learn more about that. I think we had Dr. Franklin Brown on last year during this series. Oh, thank you. This is from a patient saying, kudos to the survivorship clinic team at Smilow. I recently had an appointment. It was a very good experience. It would have been wonderful if all Smilow patients could be seen there. So we never turn away a patient. If you're on this call and you're wondering if you can come, you can come. Actually, patients who are living with chronic cancer have taught me so much in this capacity as a survivorship director, seeing them over the decades and really learning what is not helpful to them to go over in a visit like that, and what is helpful and what to focus on. And, just want to call out, there was a young cancer survivor living with metastatic disease who said, I know what I have, like, you don't have to keep reminding me. Can we just, I want to talk about how to optimize my health. And I miss her every day. She was a super dear patient, started a young adult support group, and just really impacted all of us and taught me so much about how our words matter to patients all the time. Let's see here. What am I missing? Chloe put some her email into the Q&A, I think. And there is this beautiful thing that came just to the hosts and panelists. I wanted to read this out loud. I have been a cancer patient for 42 years. Wow. 3 different kinds. I decided early on that I don't give cancer what it wants from me. I only give it what it needs from me. If I give it what it wants, it will take my entire life. Thank you for sharing that. That's profound. We're just past the hour here, and I feel like we're coming to a natural close. And, you know, again, any parting words from the panelists? I'll just stop talking for a moment, and then we can close out.
I appreciate all the attendees and the wonderful questions, and I think we continue to learn from all of you, and thank you for being here.
And just as we might not get this right every time, it's an important place to start. I think this topic is just one that really needs to be reiterated over and over. And this is our ground zero here. So thank you all. Please give us feedback, and we are so welcome to meet you and talk to you more. And if these topics resonate or not, you know, we'd like to hear from you directly. So my number or my email was in the chat. It's tara.sanft@yale.edu, and I'd be more than happy to help answer questions or get plugged in with resources or refer you to the survivorship clinic or back to Chloe for advanced care planning, etc. Thanks, everyone. Have a great night.
Thank you. You too, everybody. Thanks for joining us. Bye-bye.